And now I would like to invite Professor Mohamed elmadawy for his topic, Management of Common Femoral Artery Occlusion in the Wake of Endovascular First Concept. And I'm sure we have a very fruitful discussion at the end. Most of us have questions for you.
وانا محتاج الماوس نفسه عشان فيه هايبر لينكس ادوس عليه موجود هو. ده موجود وده موجود. طيب ماشي. دوستو. Good morning, ladies and gentlemen. We are going to talk about the management of the common femoral artery occlusion in the wake of endovascular first concept. There are peculiar characteristics of the common femoral artery. It is the access site for so many interventions, and it is a pivotal artery for bypass. It represents an outflow for suprainguinal bypasses and inflow to the infrainguinal bypasses. PTA of the common femoral artery may lead to dissection requiring stent, and stent in that positions is subjected to both static and dynamic strains and are subjected to in-stent restenosis and stent fracture. A common femoral artery endarterectomy, the standard procedure for the treatment of obstruction of the common femoral artery for more than 50 years, has a durable patency and can often be performed with epidural local anesthesia owing to the location of the common femoral artery, which is relatively superficial artery. In an analysis of 117 patients by Ballotta et al. At 2010, no perioperative deaths or major complications had occurred, and the 7-year primary patency was 96%. Assisted primary patency as well as the limb salvage rate were both 100%. The 7-year rate of the freedom from further intervention and survival, freedom from intervention was 79% and survival rate was 80%. The National Surgical Quality Improvement Program study by Nguyen et al. At 2015 reported that the common femoral artery endarterectomy was not a benign procedure. The 30-day mortality and morbidity rate was as high as 50% in more than 1,500 cases who underwent common femoral artery endarterectomy, which compares unfavorably with the data on the endovascular therapy in this setting. When we discuss the endovascular intervention of the common femoral artery, we should discuss it under the subset of 3 modalities. First, the PTA stenting, second, the bioabsorbable stents, and third is the orbital atherectomy. PTA and stenting of the common femoral artery, with a few exceptions to date, endovascular intervention of the common femoral artery has been predominantly performed by ballooning and stenting, and therefore the results are a mixture of both, and you cannot tell if the success is due to the ballooning alone or the stent or both. Individual studies by Bonvini et al. 2010, Siracuse et al. At 2017, and pooled analysis by Pitts at 2016 revealed that the procedure success rate of the PTA is ranging from 90 to 95%, with the complications as low as 6.9% in one study. However, the restenosis rate as high as 28.7 over 1 year, and more than almost half of the patients at 5 years have restenosis rate, much higher than those typically that had been reported on the endarterectomy. Endovascular versus open repair of the common femoral artery by Gouëffic et al. At 2017 from France. He compared an endovascular management of the common femoral artery and common femoral endarterectomy, whereas clinical, morphological, and hemodynamic outcomes were comparable between both techniques, but the perioperative morbidity and mortality rate was significantly lower with endovascular therapy by stenting comparing with surgery. These attractive results are mired and roiled by the limitations of the study itself. There is an absence of blinding, and interpretation of the secondary outcome in terms of the patency and freedom from the secondary intervention and survival were all not well interpreted, and they did not report on the long-term patency, which is of a greater concern. The bioabsorbable stent implantation compared to common femoral endarterectomy at 2014, it revealed that the bioabsorbable stent is not an option for occlusion. It is a must in case of the occlusion. It has a limited option in cases of the stenosis. Clinical and hemodynamic results are comparable for the bioabsorbable stent and common femoral artery endarterectomy. There is an increased rate of the redo in case of the bioabsorbable stent, but this is outweighed the lower surgical rate of infection in endarterectomy. Short-term patency rates are significantly worse in the patient undergoing common femoral artery stenting with bioabsorbable stent implantation. Third is the orbital atherectomy of the common femoral artery versus superficial femoral artery lesion by Lee et al. At 2017. This is the confirmed registry, which enrolled more than 4,000 of the lesions from 200 US institutions, and it is one unique study of its kind. It compares the common femoral artery lesion and SF lesion, how they do if they are performed by orbital atherectomy. The results can be summarized. Overall complications was with the common femoral artery group, and the dissection was similar in both groups. There is no statistically significant difference. Flow limiting dissection was 4% in the common femoral compared to 8% in the superficial femoral group, and also it is not statistically significant. Stenting of the common femoral artery was performed in 40% of the case compared to 49% in the superficial femoral group. Orbital atherectomy related dissection was higher in the common femoral group more than of the superficial femoral group, and this was statistically significant. Spasm had occurred at a rate which is not statistically significant, and there was no perforation in such study. These are the recommendations which has been published 2017 in the European Heart Journal, and it shows that in case of the common femoral artery lesion, hybrid therapy is adopted. في حاجة غلط يا أستاذ. المفروض دي بتنقل على حاجة تانية. رحت فين؟ المفروض لما كليك دي ينقل على حاجة تانية. أيوة صح كده. لا مش دي برضه، مش دي يا أستاذنا. لما أدوس على معلش يطلع لي سلايد فوق تاني. سلايد تاني فوق. مش دي أيوة. تمام كده. These current recommendations, involvement of the common femoral artery by significant stenosis or occlusion is indication for open repair. Hybrid techniques are reserved for patients with concomitant SFA or popliteal artery stenosis only. It condones two things. First, the class of recommendations and the level of evidence. And second is the association of the common femoral artery occlusion with occlusion of the superficial femoral artery or the popliteal artery. This is an example of a female patient who presented to us by critical limb ischemia and had occlusion of the common femoral artery with tandem SFA stenotic lesions. She had a surgery of unknown documentation 2 months before. In this patient, we had performed an ilio. This is the last.
Okay. Just.
An iliopopliteal bypass together with خلاص شغال اهو خلاص iliopopliteal bypass by 8 millimeter PTFA graft, and the patient had amputation of the 2 toes of her foot, and complete healing of her wound developed over 2 weeks. Thank you.
Thank you so much, Professor Mohamed.